Justice and Mercy Community Integrated Project, JAM, was started to help the less fortunate in the society, to empower them to take charge of their future. Since 1995, JAM has transformed from a holiday club for the children orphaned by HIV and AIDS to be a holistic change facilitator serving the orphans, widows, their guardians, and other vulnerable populations in the community in Homa Bay County. It's a people-centered development organization championing socio-economic growth and advancement of vulnerable and less developed. Our core programs include integrated health, food security and livelihood, mentorship, and peace building. This is our story.
This is a community-based organization built on the foundation of Christianity and was started way back in 1995 as a holiday club. Basically, we were nurturing children in a Christian manner, and during that process, we realized that these children, some of them were going without meals. They were also lacking some of the necessity for their education. We were going through a very difficult time of HIV and AIDS. So some of them were AIDS orphans. But in 2000, then now we realized there was a big problem. So we decided to invite some of the guardians and parents of those children that the baseline had informed us that either they were orphans or they were vulnerable children. And it was like, how can we work together with this vulnerable population to take care of the children? And that's how we introduced Widows program in the organization. And in that year, we thought of reorganizing JAM as a community-based organization.
And so JAM stepped in, first of all, to help these widows feel comfortable and lengthen their lives. Because once you're able to take medication, you are shown love, you are given housing, you are given food, your life is sustained and you're able to sustain those depending on you.
Our vision as an organization is to see a just, healthy, and empowered society in Homa Bay County.
Since JAM's inception, food security and livelihoods projects were integrated to strengthen household food supply through improving food availability and income for rural widows, people living with HIV/AIDS, poor farmers, orphans, and vulnerable population through sustainable agricultural practices. This has improved over the years through community trainings and empowerment of vulnerable population in areas of bio-intensive agriculture techniques, organic farming, climate-resilient techniques, agroforestry, value addition, seed bulking and preservation, post-harvest management, agribusiness, and environmental conservation.
Unajua zamani kulikuwa na hii ugonjwa tulikuwa tunaita HIV/AIDS. Dawa hii kwako, watu walikuwa wanakufa. Sasa kukutana na JAM, tulipata mabadiliko. Walikuwa wanatufunza vile tunaweza kukaa, walikuwa wanatupatia chakula kama support food, na madawa pia walikuwa wanatutafutia.
The main thing that we encourage is farmers doing agriculture in a smart way. We call it smart agriculture. That's where we involve several interventions, like the double dark beds. We bring in the BSF because of the organic farming. We also train farmers to diversify in various methods of farming. We use a contact farmer approach, where we train the contact farmer, then the contact farmer trains the group members. We have groups of 150 in the project, and we have 150 contact farmers that have been trained on good agricultural practices. It is not only the impact in terms of the good agronomic practice, but the impact in terms of the nutrition level at the farmer level.
Tumepewa hata ng'ombe wa maziwa. Ikiza tunaibadilisha, tunapatia mtu mwingine Sasa iko hapa kwangu.
We have witnessed so many farmers who have changed their minds because demand for extension services has improved. Another thing that we have seen as an impact is how the community are now changing their attitude towards sustainable land management.
It all started with paying school fees and providing breakfast for orphans and vulnerable children to establishing vocational centres, providing school uniforms and temporary shelters for needy orphans. JAM's mission was to create hope for widows and education opportunity for orphans and child-headed households during the HIV and AIDS scourge. Currently, the programme continues to support orphans and vulnerable children with school fees, so as to ensure their attendance and retention in schools.
JAM has been sponsoring students in this school in terms of fee payment, and a number of them, if I may confess, if it were not for that organization, they would not be in school as we talk today.
I appreciate I'm in school and I've not been sent back home because of them. So I can say that has also helped me to achieve my ambitions, improve on my performance academically.
JAM community began when I was in high school. That's back in 2016 until I finished my KCSE during the 2019. They took hand of me when I joined campus. That's at Masai Mara University that I've studied until by now I'm in my final year. I'm graduating by December.
The programme also implements mentorship sessions to teenagers on various topics like personal development, communication skills, HIV/AIDS, drug abuse and career choice. Health talks are also provided in selected schools to ensure adolescents develop healthy behaviours that supports their education as guided in JAM's mentorship manual.
Children were getting expectant at a very rampant speed. Then they told me we are going to organize mentorship to these learners, at the same as coaching them, and also health talk, so that from the health talk they could learn how to take care of themselves.
The children which JAM bring for us on board, we see the results, yes, because since we met with them, most of the children have known their right, and once their right has been infringed, then they know which are the medias or how to respond to that.
The organization is contemplating, and maybe the management is serious about it, that we will expand so that we can accommodate people whom we actually see as vulnerable and have no any other way out. Because like us, we've been targeting our community groups with whom we are working.
Youth empowerment is done with a focus on out-of-school youths who learn basic computer skills and how to access business through online platforms. In the 90s, HIV and AIDS epidemic teared families apart, leaving orphans and widows to suffer. JAM was among the few organisations in Homa Bay bold to fight the plight to save future generations. Centres with groups of widows were created to bring services closer to the people affected with the disease. The main objective was to counsel the affected persons to cope with the disease and also creating awareness in the community to reduce the rates of infection and stigma. In support of the comprehensive home-based care programme, JAM trained community health workers and volunteers to help promote health, nutrition and hygiene, to give confidence to patients and also to refer them to the nearby health facilities to treat opportunistic diseases. Due to negative experiences in various health facilities, JAM was forced to start a community health clinic where patients could be treated well, handled with dignity, and their rights observed. Today, JAM is operating a fully fledged hospital offering various services to the community in Homa Bay County.
Swindon started in 2004. It started as a clinic. By then we had a burden here for people who had been infected by HIV. The outbreak was big. So that's when this clinic started to offer services for free. That is HIV/AIDS services here. Then later, that's how it started to grow now. We added more services, that is outpatient services, inpatient services, maternity, MCH. Also we have now newborn unit around.
Apart from the death, HIV/AIDS related death, there was also this infant mortality, and where women who are pregnant were losing their life because they could not access the modern facility. Apart from that, because of the distance, they could just be using the traditional birth attendants, and when things get haywire, they could not be helped. We constructed that hospital with the help of Swindon College students, and of course with the help of Bread for the World. It has grown.
We have these people, so-called CHVs, that usually help us to identify common elements in the community, and then they give back report to us. That's when we can plan and go to visit those people in the community, those through our outreaches.
Concerning the relationship between the villagers and me as a CHP, it has become much interesting because they appreciate the work that we are doing to them, the visitations that I make into my community. I always visit them from pregnancy to old people.
JAM has helped us to do testing within the facility, to do outreaches, like there's a time they would really help us to do moonlight outreach just here in town, where those who don't want to be tested in the day are able to access testing in the night.
Watu kama sisi, there are some commodities wanafaa kutupea, lakini hapo kwa wote hazikuangi. So tunaomba hao watu wa JAM saidie kwa hizo commodities. Vitu kama tusaidia ma-CD na self-testing kits za HIV tusaidie.
Peace building and conflict management is crucial if JAM's programs are to be effective. We work with communities to address the root causes of conflict by promoting social justice, reconciliation, and community development. We empower vulnerable populations to resolve disputes peacefully rather than resorting to violence. JAM's peace-building work involves addressing land disputes, resource scarcity, social inequalities, and historical grievances that often fuel conflict. Our focus is grounded on the principles of justice to address grievances and mercy to foster forgiveness and understanding within communities. This is crucial for long-term peace.
JAM has really been supporting us in the issues of peace building initiative. The first thing that we thought is probably to call all the stakeholders involved, including the district peace committee. And the most important thing that we just emphasized was to maintain peace, particularly during campaign period.
They normally organize for us workshops for peace at the sub-county level, even at the county at times. And they enable the government to form peace committees, which is also our core function.
In our peace building focus, we realize where there's no peace, there's no development. And where there are conflicts, all the development gains and the development efforts of the community can come to no avail.
Wagone joka JAM erokamano, ene mong'eyo ni jo boda boda to nyalo rito kwe machalo nade geringo kanye gi kanye, to kwe mane ei Homa Bay chalo nade, to Ashwa Rachuonyo South Kasipul. JAM osebedo kong'eyo ni jo boda boda gin ji adi, to gin joma chalo nade, riwruok margi otwere machalo nade.
Some of the causes of the conflicts around the global is as a result of the climate change. People fight over little resources. That's why we are saying each and every person we are working with in this rural part of the world, we need to establish a livelihood. And that's why we are coming up with climate resilient or smart agriculture, but also climate change intervention. It gives a smile in the faces of many. When one particular poor, vulnerable, somebody who is undergoing depression, somebody who is undergoing stress, all that burden is relieved of. That's where everybody's heart should be and their resources should be.